I first say the most important, the title, secure the global health through research, innovations, and empowering the frontline soldiers. So it's my choice as a soldier because I am proud to be the frontline healthcare workers. So the nurses, the God-gifted job. When you serve the humanity, it's a God-gifted job. So every religion have importance of this human service. So God provide you this field. So we need some sort of motivations when you are managing patients. So we have, because I am interested in geriatric, so I make some title for this frontline soldier, because now you are look at the world. The frontline soldiers, they are doing the best, like nurses or the doctor or the paramedic, like in Palestine, like in Ukraine. You see in the war, they are doing the best, and which is a very crucial part of the world. So I have choose this topic for the global health, how to approach a geriatric patient frontline soldier. So this is our manifesto. Our country is our proud. So we must do for that. So अल्लामा अकबाल का एक शेर है जो मैं ज़रूर कहूँगा अपने जूनियर्स के लिए और अपने सीनियर्स के लिए कि मंजिल से आगे बढ़कर मंजिल तलाश कर, मंजिल से आगे बढ़कर मंजिल तलाश कर, मिल जाए तुझे दरिया तो समंदर तलाश कर. So basically this learning is always an attitude to give service to the humanity. So I have made this outline, which is the definitions of this geriatric nursing, what are the demographic shift, and what is the consensus of 2017 shows in Pakistan, and what are the common geriatric assessment, what are the role of the nurses in the assessment, what is the real patient scenarios which we see in our daily practice in our hospitals, what are the awareness we will provide to the society, and what is our management, and what is the last conclusion. So when we talk about the geriatrician, as a physician who specializes in the care of the elderly people is called a geriatrician, but the geriatric nursing, there are very different and very broad scope of the nursing. In pediatrics nursing, we have in maternal nursing, we have a pharmacologic nursing, we have varieties of the nursing in the hospitals. But I am talking about the geriatric nursing, the field of nursing that specializes in the assessment, planning, and implementations and evaluation of the old citizen and all environment. So if you are in smiling face, your attitude is smiling, always see your patients have a confidence and he has a very good outcome of the disease. So जब हमने demographic shift देखा, what is the aging? The world is aging fast. So our जो हमने population, every tick of the clock, we have a 2% crossing 60 years. And up to the 2050, from 12% to 22% of our populations have this geriatric or old citizens. And 900 billion to 2 billion, 1/5 populations will have this. So basic element of this geriatric assessment is patient centered. कि हमारा जब हम हॉस्पिटल में होते हैं या हम वार्ड्स में होते हैं या हम ओल्ड एज होम्स में होते हैं या हम किसी साइकेट्रिक इंस्टीट्यूशन में हो, whatever the institution, whatever the environment, always be very careful to see the primary, secondary, tertiary prevention is more important, and to capacity to see the behavioral health, and always important the quality of life. Co-dependent health, independent health, it's important. So this is the main frontline soldier, like the nurses or the doctors or the pharmacists or anything which are working in this environment. Always very careful to give the directions, social economic conditions, and see the environment safety. And always go with the functional equity of their geriatric, or you see the activity of daily, or face the activity of daily life, or he use some support, so need some instrumental support, that's important. So when you visit our medical wards and Lumhs, we have a sort of, there's a nurses, there's a big student undergraduate, postgraduate, and so we have a different approach. And when we see the nurses, they are bigger role, they have seniors and juniors, they are here and to make it possible and see the good outcome of the patients by using a cannula. So the general principle of the care always be multidisciplinary approach by the doctors and by the team of this different multidisciplinary approach. So when you have a comprehensive geriatric assessment, we always think about the treatment and long-term follow-up to optimize the quality of the life. So you see the different assessment, see the functional class, see the mobility, तो physical activity आप देखें, आप उसके regular plan देखें, you have to notice yourself कि जब पेशेंट दाखिल हुआ था, या पेशेंट जब डिस्चार्ज हो रहा है, या पेशेंट की सर्जरी हुई है, तो whatever the situation, you have to be very careful. So always important to look at this, so see the functional abilities, diversity, and see the support, and see the mental health. Nowadays we need empathy, we need a sympathy to see the good outcome of the patient. So that's important. So who perform this CTA comprehensive geriatric? They are the nurses, they are the medical professional, they are the pharmacists, and they are different other occupational therapists. So we have a different tiers, immobility, instability like in Parkinson's, incontinency, जब आप जाते हैं बाद में incontinent patient को catheterized हुआ है, impaired memory, dementia, there are depressions, and involuntary weight loss, unknown weight loss. So what are the common problems faced by the frontliner in different locations? Joint problems like osteoarthritis or rheumatoid arthritis, special sense in hearing, or eye problem, the cardiovascular problems, the sarcopenia, which is more important, or frailty. So what is the role of the nurses in the assessment? Assess the patient's mental state, cognitive skills, acute and chronic illness, and history of fall and incontinence. So ये सब आपका काम है, हमारा काम है to see that areas. So when you see any patient in our ward, that's a 70 years age, ये हमारे पास आया था incontinence, dementia, and ataxia, movement बंद हो गई थी, bed bound था. That's a bigger role for that patient. Or when we perform the CT, it shows the CT scan brain atrophy. So at that moment, you have to calculate the common symptoms. कि fall की स्थिति तो नहीं है, memory disturbance तो नहीं है, या weight loss की स्थिति तो नहीं है. So these are the functional class. I don't go on the. So we have a different assessment of the outcome. तो outcome कब होता है जब कोई old patient आपके पास अपने independent हो, you treat as a young, you work as a, and you investigate like a young, and you have to treat like a young. So we have this nurses in our ward, and we have senior nurses, and they educate and to guide with the junior nurses, and see to make the plan in the reception, which is center in the hospitals, and they have to because you are the pillar of the hospitals, of the institutions, and for the education system. So if you have a good character, your values, you are confident, your patient look at you with empathy and with sympathy. So this frailty is a very common term used when you have a decrease, because in old age when there is a decreased mass, decreased strength, this frailty which leads a common problem of the fractures and of the problem of different health issues. So we have a patient comes with their own dependency. किसी को प्रॉब्लम हुआ कि चलना नहीं हुआ तो स्टिक ले ली और ही गुड सपोर्ट है आपके पास आएगा डॉक्टर साहब 6 महीने से प्रॉब्लम था अभी मैंने स्टिक यूज कर दी है This is the ward rounds in our medical, and you see the nurses and the doctors and the team they are. So we have a multidisciplinary approach, and it's a teamwork. So nurses have a very strong role in the management and the patient care. So challenges Pakistan के क्या है? Socio-economical, financial issues हैं, limited healthcare system है, resources. So what the delivery of the health between elite and poor? So we must be very equal. चाहे वो elite class हो, चाहे वो lower, we have to give a proper health care to all those situations, whatever the environment. Because 73% जो pocket का खर्चा है वो उनके own होता है, अपने pocket से. So we see a different, madam, we see a different areas. तो हमने जैसे मैडम परवीन की बात अच्छी लगी कि we are going to the schools or communities. तो we have a same now from this institution we go to the areas. तो ये एक मियानी फॉरेस्ट में हमने रखा था कैंप कि कॉमन डिजीज के बारे में उनको बताया जाए. तो we have a see उनकी एक्टिविटी देखी, इंस्ट्रूमेंटल सपोर्ट देखे, और जो हम कर सकते हैं उनके लिए कि how to treat undergraduate or postgraduate, how in the ward the nursing or the healthcare workers make a discussions about the patients, about the outcome, and we have a common disease awareness walk at the root level, at the schools or at these communities, and we have the common disease like a diabetes. So involve the patients, involve the families. So for a race you make a teamwork, and for a race in COVID, I salute to all the healthcare workers, the frontline workers who have done the great job in our hospital in Lumhs. I salute for that, who have done in the ICU, the CCU and the ward. So we have a different outcome when you have a great team in your ward, and especially the staff, especially the nurses, especially the healthcare workers. So that's important. You have to give the awareness to the society, and the basic is, what is the aim of this lecture? To manage the health of the senior citizen up to the high level and engage the avoidance of the disease, and train the trainee who have nurses at the global level, at the local level, early detections and the treatment of the disease, delivery of health with equity without any difference and discrimination. That's our aim. तो एट द एंड में कहूँगा, क्योंकि कल्चरल डे भी है हमारा, आप सबको सिंध में वेलकम जो बाहर से आए हैं, और एट द एंड में अल्लामा अकबाल का ये शेर कहूँगा कि खुदा करे इस अर्ज पाक पर उतरे वो फसल गिल जिसको अंदेशा है ज़वा ना हो. पाकिस्तान. Thank you.